So, okay, welcome everyone to our weekly meeting, the Moksha Seniors meeting. And as promised, that every week we have various sessions on relevant topics, and all the members who have joined today are most welcome. On behalf of Moksha, I would like to share with you the mission statement of Moksha. Moksha Canada Foundation will bring awareness, provide education, create need-based programs and services in arts and culture, health, and wellness to foster and sustain safe, healthy, vibrant, and inclusive communities. We all know Moksha Canada Foundation is a registered NPO, non-profit organization, which is working towards ensuring well-being of all individuals, the families, various communities, and in the York and GTA regions of Ontario. So, and we have plans, programs to provide essential social services, community development, art and cultural projects and programs. So, okay, as we believe at Moksha, we believe in philosophy to connect and create and participate. Here we are in the weekly seniors meet, where we have this session on dental awareness. And this dental awareness session, we have Dr. Prabjot Kaur. Dr. Prabjot Kaur Saini, she did her B.Ed from Punjab Government Dental College in Amritsar. And she cleared the equivalent exam with NDEB in Canada to practice independently here. And she's been practicing all aspects of dentistry for all ages since then. And she runs a private clinic in Etobicoke as an active member of ODA, CDA, and AGD, which I guess are the dental organizations. Dr. Saini regularly participates in continuing education programs to keep up with the changes in the practice of dentistry to treat her patients safely, comfortably, especially keeping in view the COVID times. And she is a mother of two beautiful teenage daughters, and she loves to stay fit. She exercises for that. She loves gardening, and she loves to cook too, which is a virtue amongst women especially of Indian origin. So welcome, Dr. Prabjot. So we are a group of seniors. We have our weekly schedules, weekly meetings on Thursdays. And we welcome you to enlighten us about dental hygiene, because we've been we know that since childhood के beautiful दांत जो होने बड़े खूबसूरत दांत होने बड़े जरूरी है ते बड़े सोहने दंदासे दियां गल्लां बहुत असी सुनिया पंजाबी गीतां च और जो मुस्कुराहट है हमारी दांतों से रिलेटेड है तो जैसे मोती जैसे दांत दिखते हैं हम सुनते रहे ना बचपन से तो मोती जैसे दांत आफ्टर सर्टेन एज वो मोती जैसे दिखने तो शायद थोड़े थोड़े होते ही होंगे और अंदर से उनमें क्या हो रखा है only we all know.
Yes, of course.
Okay. So how to keep these moti jaise dant, and of course how to look after, especially keeping in view the seniors. Welcome.
गीता जी, आपने कहा मोती, जब मोती है तो उसमें सुराख होगा ही होगा, तभी वो मोती कहलाएगा, नहीं तो मोती नहीं है।
तभी मोती जैसे कहा ना, हम चाहते हैं सुराख ना हो।
होना तो नहीं चाहिए। Okay.
Good. आइए डॉक्टर प्रभजोत।
Okay, I'm sharing the screen.
Okay. Yeah.
I'm going to start from here. The highlights for today is the common dental problems among seniors and treatment options, and importance of dental hygiene and taking care of your teeth. And being a senior is the journey of being toothless to having all the teeth and then gradually becoming toothless. This is like, if you follow those good oral hygiene habits, you can actually uh, avoid to become a toothless in your later ages. And with the advancement of medical science, there is actually increase in the life expectancy. And as a result, more and more seniors, they can actually keep their teeth as they grow older. And having the teeth means more problems, more you have to be on top of the oral hygiene measures. Just a quick look at this is how our teeth look. The top part, we say it as the crown and the root. And this is how like the gums we have. And then from here, I will start explaining the different things. And mostly as we go, we have the more common oral diseases are the diseases of gums and teeth. Then we have different type of mouth ulcers. Then the seniors have problems and some type of cancers which come in the old age, but they are like not very common. And I'm not going to take this to too much detail because that is more the profession related. And then the denture related conditions. And let's start with the gum diseases. Gum diseases are like, there is a problem with when people say that they have the bleeding gums, swelling of the gums, and the gum recession. As you see, like, but in the seniors, they are mostly, these things happen when they are getting more medications, and then when they get sick, they are unable to perform the regular oral hygiene. That's the thing. In case on the healthier adults, is mostly the worsening of or already existing disease. And then the gum diseases are mainly caused by poor oral hygiene, then the faulty toothbrush habits, and certain prescription medication can cause the gum diseases too. And then medical conditions like heart diseases, diabetes, stroke, and then the physically debilitating diseases like arthritis, when we are unable to perform certain things because our joints, they don't work fully, and we cannot do things which we need to do to keep our teeth healthy and clean. Then the treatment is the good home oral hygiene measures. They help contain the gum disease as much as like, try to do the brushing and flossing as much as possible to keep the gum disease in control. Then getting your teeth cleaned professionally helps, because that then when we do the cleaning in the offices, we do try to reach all those areas which are unable for a person to do themselves. Then like for some of the patients, surgical interventions are also needed to treat the gum diseases, so that we don't get to the point where we need to take the teeth out. So worsening of the existing gum disease is mainly the issue with the seniors. So proper home oral hygiene care like measures, they help maintain the gums. And then the other problem which we see mostly is the sensitive teeth. Sensitivity is very common as we grow older, the gum recede, then the recession of gums expose the roots, and the roots, they become more sensitive to all the stimulus, because the enamel is the insulating layer over the tooth, but the roots don't have the enamel. That's why they feel more sensitivity. And if you have the dental caries, then also you feel the sensitivity. For the treatment, if you have the caries, you have to get the fillings done to take care of the dental caries, so that those areas are covered and you don't feel the sensitivity because of that. Other than that, keeping good oral hygiene, and if that even with the brushing and all the measure, if you are still feeling the sensitivity, you can use the Sensodyne and the other anti-sensitivity products available in the market. And if that still does not help, you can always talk to your dentist. There are certain things which we use in the clinical setting which desensitize the affected teeth and help you get out of the sensitivity issues. The next is dental caries. The dental caries are like, they are normally anything from dark yellow to the black lesions, they are soft on the hard tooth. And they are like, they are there, and when the cavity is there, you start feeling the sensitivity to hot and cold. And if we don't fill those cavities sooner, and they start affecting the nerve underneath, then that's when you start feeling the pain also. And but in the seniors, the cavity of the tooth mainly pertains to the root part of the tooth, because when the roots are exposed, they are the softer as compared to the enamel, and they start getting affected more. And the root caries, because of the gum recession, dry mouth, and then physical inability sometimes with for the proper oral hygiene and prescription medications. And treatment here is minimal cavities like can be filled, and once it's filled, the cavity is taken care of. Anything when it's the deeper cavity and causing the pain, once you are in the pain problem, then the tooth mostly needs a root canal. Otherwise, the pain does not subside, and then those teeth needs the crown. And sometimes the cavity is too big, the extensive, that we have to pull the teeth out. So especially when it comes to the dental caries, so they need to be diagnosed earlier and treated earlier, so that we avoid having the more expensive treatment options and losing the teeth. And the preventive measures are like brushing twice a day, flossing, and brushing before going to the bed is the key, because when we brush before going to the bed, that is the longest time during the day when our mouth, we will not be eating and we will not be doing anything, and our mouth will be cleaner. The longer time the mouth will be cleaner, the chances of getting the issues are very, very, very less. And then to avoid having the gum recession, change your brush every three months. That helps, and it can be more often, because some people, they brush like they brush when using the very heavy forces and in the very heavy strokes also. So those ones, like they fray the brush bristles so quickly. So it's advisable to change it more often. If 3 months as you see that it's still not working, like if get frayed quickly. And warm salt water rinses, that is like many people, when we heard, they say that they want to use something to rinse their mouth every day. Mouth rinse available over the counter. They keep they have the alcohol in it, which makes the mouth drier. Dry mouth is more common in the seniors and can lead to the gum diseases and cavities. So instead of using the over-the-counter rinses, warm salt water rinse has the better value over time. Like if you cannot do every day, is fine. Like try to do it more often. That helps keep your mouth moist and help with the oral diseases. Then the next is loss of teeth. So loss of teeth is declining. We have so many different treatment options available that we can save the tooth in its present condition. So far is not like rendered unsalvageable. So, but then once we start losing the teeth, it can be partial, losing a few teeth to the complete loss of the teeth when all the teeth are gone. These are caused by the gum diseases or the dental caries, and sometimes the accidents also. Seniors having the fall can cause the fall on their face, and they break their teeth. That can also be the reason to lose the teeth. And loss of teeth is very, very critical for the good physical health, because you are unable to chew food properly, and that food, when food is not chewed properly, is not getting digested properly, that result into the malnutrition. And malnutrition can cause the different other issues. And for the partial and complete loss of teeth, there are different options of like partial dentures, full dentures, and then the bridges, and then the implants. These are the ways. And like replacing the teeth is always advisable to maintain the aesthetics of the face. The otherwise toothless smile reduce the vertical height of the face, and that the person looks older. And this help enhance the taste of the food, and then you can eat properly, you can maintain your nutrition level. The next condition is the abrasion, attrition, and erosion. These are different forms of wearing of the tooth structure. It can be pathological, physiological, or chemical based on how the things are happening. The abrasion, like if you see in the picture, those areas, when some people like they brush horizontally, they are brushing horizontally and they are brushing with the very heavy strokes that cause this kind of cavities. And they like when they form, they cause the tooth to be very, 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 very sensitive. And then holding teeth, like some people have habit of holding pens between their teeth, and some people hold pins, like we see the tailors, they hold the pins because they are using them for their markings, and they keep holding that. And wherever you hold these, you will see the notches appearing on the teeth. These type of the wearing is called the abrasion. The next is erosion. These happen when you drink a lot of carbonated beverages or citrus fruits, or chewing on the sour candies, or even the medical conditions like gastric reflux. When the acid is coming to the mouth, then the enamel layer on the teeth is starting to dissolve. And if you're holding like with the pop, many we have seen like people, they hold the beverage in their mouth because they don't swallow it right away. And then when they hold the beverage around the tooth longer, the teeth start to lose their enamel, and this is what is called erosion. And then is attrition. Attrition is normal wearing, because as we grow older, we eat, and then because of the eating, the teeth come together and they get worn off. But sometimes some people have the habit of grinding their teeth during the day or night. So that habit caused the wearing of teeth a lot more. And whenever we have the wearing on top of the tooth, these are the conditions when they slightly become unrestorable sometimes, because these things, they don't retain the fillings well. So here we recommend to use the mouth guard so that you don't bare your teeth too much when you are grinding at night. And also this is happening because of the very, very high stress levels. Try to maintain the stress by reduce the stress by meditations, talking to peers, talking to friends, the family. They are the big support system to get you out of the stress. And that helps with the proper overall physical well-being. Then some of the lesions, then we have the issues of the soft tissues in the mouth. They can be traumatic when you are brushing harder, your filling is broken, your teeth are broken. If you're wearing a denture which is faulty and it keeps hitting the tissues, or if you are in the habit of biting your cheek or lip, those are the lesions. They need to be addressed. Then canker sore. Canker sore is when we get the sores in the mouth. They mostly happen with the stress. It can be physical or mental stress. So and the other one is herpes simplex. These ones are caused by the virus and some of the bacterial and fungus infections too. And chemical burns, sometimes some people hold their medications in the mouth, especially the aspirin, because you can actually, they are dissolvable. If you are holding that medicine longer around the tissue, you will see the chemical burns, and they cause the sloughing of the tissue, and which is painful. And all these like soft tissue problems, they resolve by themselves over 10 to 12, 14 days in younger people. For the seniors, they may linger on to up to 3 to 4 weeks. So if this is something which is bothering you, it's good to see your family doctor. It may be something different which is not resolving properly by itself, or needs some other intervention. And then for these kind of situations, the home remedies are restrict excessively salty, spicy, and sweet food, because they cause the problem with the digestive system, which in turn cause the problem on the soft tissues and cause the different type of sores in the mouth. And rinsing with the warm salt water is helpful. And Oragel, it is available over the counter. It helps to relieve the pain. And they are like, they will only help you get through the pain. They will not resolve the situation by themselves. Most of the symptoms they relieve by themselves. If not, then you may need to get some prescription prescribed by your doctor. The next is xerostomia, or dry mouth. Dry mouth is the feeling of feeling the mouth dry all the time, or it happens with a decrease in the production of saliva. And almost 22% of the population have this problem. And this out of this population, mostly are the women. As they get into older age, the saliva production reduces, and that causes the dry mouth. And the saliva helps to keep the tissues healthy, keep them lubricated, and keep them buffered so that outer thing, like the chemicals, they don't really affect too much on the soft tissues, and they keep them into the healthy condition. And then they control the bacteria, because saliva flushes out the food from the mouth quickly and constantly. So that helps to keep the mouth clean also. And saliva helps to digest the food also. And people suffering from dry mouth, they complain from new caries, which they were not having it before. And they have difficulty in chewing, swallowing, and tasting, because the saliva, without like proper moisture in the food, you find the swallowing is harder. And then the dry lips, and mainly on the corners of the lip, if you see any lesions there, that means the mouth is getting drier, and that needs to be addressed. Then the burning feeling in the mouth, and complaint of getting the mouth infections like fungal infection, which is more common when the mouth is drier. And dry mouth and certain medication also cause the dry mouth, like the medication we use for the pain and anxiety, diabetes, and mainly like some of the blood pressure medications, they also cause the dry mouth. And then the diseases like diabetes, anxiety, depression, kidney disease, they also cause the dry mouth. And the treatment of the dry mouth is the sip water frequently all day long. Sipping to the water, like don't gulp the water at one time. Take one glass of water, keep sipping throughout the day. But if you gulp down, it does not really help with the saliva. And then they restrict the caffeine, avoiding the mouth rinse, having the alcohol. Alcohol is another thing which dries the mouth. And then the warm salt water rinses is very beneficial in keeping the mouth moist. The salt water helps to bring out the saliva. And then the humidifier while sleeping, and then using the petroleum jelly or anything to keep your lips moist. And then brushing, maintaining oral hygiene is the key to all the oral diseases. And using the toothpaste with fluoride, they help strengthen the teeth to help them not get the cavities. And avoiding the spicy, salty food, they also help with the dry mouth. And then there are certain saliva enhancers available over the counter like biotin. Use of that helps to keep the mouth moist. And then there are gums containing the xylitol. Xylitol helps to increase the saliva. If you chew on that kind of gum, the salivary production is increased. And there are certain conditions affecting the tongue. And tongue conditions are mainly, they are caused by the physical or mental health, and then nutritional deficiencies, certain systemic diseases, prescription medication, and dry mouth, and poor oral hygiene. Drinking too much coffee, eating too much refined food. Refined food does not let the tongue get clean. Eating more whole food like vegetables, fruit, they help clean the tongue automatically. Then you don't really eating the whole food. The tongue needs to work, and it gets clean by itself. And brushing the tongue is also very important to keep it clean. Treatment include The treatment of tongue conditions include the controlling of the stress by the relaxation techniques, or you can ask your doctor, they can prescribe the medications to help relieve the stress. And then the dietary supplements, many vitamin and mineral deficiencies, they cause the lesions on the tongue. Getting the proper vitamins and mineral supplements also help with the tongue conditions. And tongue hygiene is very important. Brush your tongue using the toothbrush or the tongue brush every time you brush your teeth. It helps keep the tissues clean and clear of all the plaque which forms around. No plaque, no oral issues, less oral issues. And importance of oral hygiene. The advancement of medical sciences has helped to keep our teeth longer, but keeping our teeth longer, making the treatment of the dental care is more complex because of the underlying physical and psychological issues as we age. So poor oral hygiene causes the bad breath, bad smell, bad taste, and it impairs the ability to chew food properly and cause the dietary deficiencies and weight loss, because you cannot chew food properly and cause the malnutrition. And it also affects older person's appearance, self-esteem, self-confidence, and ability to communicate properly. Because if you don't have teeth, the tongue, you always feel that there is a lisp in the communication. People try to avoid communicating because they don't feel comfortable about that. And then certain oral health and chronic diseases, they are closely related, and poor oral hygiene is the portal. And poor oral hygiene and heart diseases, diabetes, and stroke, they are interrelated. There are many studies which prove them both ways. They say that if you have diabetes, there are high chances you will have the gum diseases. People with having gum diseases, they have high chances to get the disease, get the chronic heart diseases, because the bacteria in the gum, they are the same bacteria which cause the problem with the heart. The bacterial colonies, when they go into the heart, they cause the inflammation in the heart. So they are related. And taking care of your teeth, brushing twice a day, this is something is stressed all the time. Brushing twice a day, floss at least once a day. This is a whole regime for a day. And then brush before heading to sleep, and then using the fluoride toothpaste, brushing the tongue every time you brush, keep your mouth moist, cut down on sugar and sticky foods, eating balanced diet, mostly of whole food and less refined food, and taking dietary supplements regularly, and prescription medication on time to keep the symptoms of the physical illness in control, and visiting the dentist every 6 months. And additional oral hygiene aids, there are certain additional aids which are helpful, especially when you are unable to do certain things by themselves. Brushing, powered brushes, they are helpful. They help to brush because you just have to maneuver them. You don't have to put any pressure, they do themselves. Then water pick or floss picks, Proxa brushes, they help clean in between the teeth. Some people find it harder to floss with the thread. Water pick and any those they are the aids. They help cleaning in between the teeth easier. So the powered brush, they help remove the plaque and more than the manual brushes, and they cause the damage if they are not used properly. But for the seniors, this is a very best good aid which help to maintain the oral hygiene optimally. And the other floss picks and water pick, these things, they help to when some people find it flossing harder, and with the full floss thread, they help to clean in between the teeth. And water pick especially is very, very beneficial if you have the bridges and implants to replace the teeth, and those areas, they need to be cleaned properly for the longevity of the treatment. So if you clean under the bridges, there are chances of getting the cavities under the bridge reduces, and around the implants, chances of implant failures They are contained when they are cleaned properly. So, and next is taking care of dentures. People who wear dentures, they are more vulnerable to the fungal infections because some of them, they wear the dentures at night and not cleaning the denture properly. And when they are not cleaning the denture properly, is the focus of infections. The fungus mainly because the tissue cannot breathe and the like oxygen is deficient and fungus tend to grow underneath it. So dentures need to be cleaned regularly with the denture brush and mild soap. And the brushing should be done properly and holding the denture firmly so that you don't drop it also. Dropping the denture, it can break. And then don't wear the denture to the sleep because gum needs the rest. As our feet need the rest from wearing the shoes all day, our gums also need the rest from wearing the denture all day. And don't use the toothpaste, the same toothpaste you brush your teeth with, don't use the same on the denture, it can scratch the denture. The scratching of the denture can cause irritation to the tissues, and that is another niche in the denture where the infections can grow. And keep the denture in the cold water at night. That will keep it moist and does not let it shrink. Keeping a denture out of the water longer can change the shape of the denture. Many times when people don't put the denture in the water, they see that the denture is not in the same shape. And then brushing your tongue and gums with the soft brush. And these are some denture care products. Like there are the tablets available to clean the dentures. Otherwise, regular dish soap is good enough and use it with the brush to clean the denture. But these things, they have additional products, like they have the buffers. There are so many available to clean the denture. They help maintain the structure of the denture too. And then there are denture glues. Some patients, like they always complain that even though they have a new denture, it keeps falling. And there are certain issues, like certain conditions where the proper denture fit cannot be achieved. So the polygrip, the denture glue type of things, they help hold the denture in place and help the patients use their denture optimally and help them chew their food properly if the denture is in place properly. And at the end, prevention is the cornerstone of the dental care for the elderly. I think it's for everyone. Prevention contains like brushing and flossing. If you do that, it helps contain the oral issues, and that helps with the dental. That is the main thing for the elderly. Thank you.
बहुत बढ़िया
Thank you so much. Thank
डॉक्टर
you.
सैनी, आपने बहुत अच्छी तरह से
Okay.
एक्सप्लेन किया. वी आर वेरी थैंकफुल टू यू.
Thank
अभी
you.
आप अपने ऑडियंस में से कोई क्वेश्चन करना चाहते हैं तो
हाँ जी, बोलो.
One
So-
question I want to ask. Sorry, Mitaji, you can continue.
नहीं कोई नहीं, आप पूछो.
Just one question I want to ask, Doctor. If we have some space in the teeth,
Yes.
is there any treatment at this age also? We can get the treatment of.
Yes. Like
Okay.
actually these days we see many seniors going for the ortho treatment. I
Okay.
have done myself also on a few of them because
Okay.
you know, when we are younger, our parents are responsible. They don't have money. They have their own priorities. They could not help us. When we
Yeah,
are
this
old,
is
when
true.
we are in our younger ages, we have kids. We always keep them a priority, and we don't do anything. Now we are like at an age when the kids are on their own. Now they are not our responsibility, and we have money and we can do it. Go for
Right.
it. It can be done. It can be done in any age. But yes, not everybody is the candidate for the treatment, but there are certain things which can be done to close those spaces, other than
Okay.
the ortho also.
Okay. Thank you.
You're welcome.
और किसी ने कोई क्वेश्चन
Apart from-
पूछना है?
Apart from dental thing, If you have space in between your teeth, it says, they say that you have a lot of money. उनके पास बहुत पैसा होता है, जिनके दांतों में खूब सारा गैप होता है, वो इतना इधर बहुत गैप है पर पैसा नहीं है.
सेम हियर मीता जी, मेरे तो ऊपर भी बहुत गैप है, नीचे भी बहुत गैप है. तो when I was unmarried, people used to say me she would be getting a very nice big financially sound in-laws and everything. You know, you won't believe.
Excuse me,
Wow.
please excuse me. ये मिथ्स वगैरह की बातें हम बाद में भी कर सकते हैं. डॉक्टर साहब का
हाँ जी, हाँ जी, सर.
बहुत जो
So I have a question.
फायदा लें. डॉक्टर साहब और कुछ आप कुछ कहना चाहें, अपना एक नंबर भी दे दीजिए ताकि अगर किसी ने मिलना हो तो आपसे.
Narendra ji, excuse me, Narendra ji is there. She wants to ask. She's raising her hand, but please Narendra ji unmute कीजिए अपनी. आपका शायद muted है.
I
that's
also
why.
want to. एक minute, just wait. Dr. Prabhjot, you can stop sharing the presentation so that we are able to see each other better way. Yeah, see. So now we are better off. So,
Yes,
Narendra ji, your question.
Yes, I have two questions.
Yes.
Okay.
Mostly people say that by cleaning of the teeth makes the roots of the teeth weak. Is it correct?
It actually it is correct. It is not correct. The thing is, like back home, we don't have a concept of cleaning our teeth. So the things keep collecting there. And those things are keep holding the teeth together. When we clean, now the teeth are separate. And obviously they are supposed to be separate, but the tartar and everything, they were holding the teeth together, which should not be there. So when we remove it, you start feeling them separately, and then that feels that it gets looser. But if you are doing it regularly from beginning, it does not feel that way, and it maintains the teeth properly.
And now see my teeth, I have 100% teeth.
Oh, wow.
Even though I am growing older. And second question is this, cheek biting is also concerned with teeth.
Actually, the thing is, upper teeth, they should be like this. Like upper teeth should be outside, the inner, the lower one are inside.
Low teeth.
Some of them, sometimes we have the lower teeth outside.
Mm-hmm.
I have on my right side, my lower teeth are outside and upper teeth are inside. So I tend to bite my cheek on the right side more.
Okay.
So this is the thing.
It happens, yeah.
Yes, because when the upper teeth are outside, they hold the cheek outside and they keep doing their work on the inner side of the cheek. But when it's other way around, the cheek gets pulled between the teeth and you bite yourself.
Thank you.
Okay.
Thank you very
And
much.
what is the main cause of mouth ulcer?
Mouth ulcer main cause is stress.
Stress.
The main cause is stress. Every time it's stress. For the women, like for the women mainly, like being in the menopause or whatever, this is the body get into the stress. Like when the hormones are not in the level. And for like, that's why whenever we talk about is like people, oh, I'm not stressed. Yes, we don't always talk about the mental stress, it's the physical stress too. When you like physically, your body is struggling with the change of the hormones and other things, that also caused the problem. That is also the stress. You don't feel that way mentally, but your body feels it. So
yeah, but because sometimes you get upset, stomach upset in that way, and mouth ulcer in another way. Yeah.
Anytime you have stomach upset, you do tend to get the mouth ulcers.
Yeah.
Yes.
But stomach, whenever I usually get mouth ulcers, means, but whenever I went to the practitioner or something like that, they always used to ask me first question, is your stomach is okay? I always say, yes, my stomach is okay. My stomach is fine. But what is the reason? What is the cause of mouth ulcer? I'm not getting that. But then they give some gels or some medicine and then it becomes perfect. But after that, a few days again. But now I'm better now. Maybe that is the reason you are saying the stress is the main reason. Maybe that cause can be,
because we don't realize, like especially women change in the hormonal levels, that cause the biggest stress.
You're right. Agree. Thank you.
So my question is about drooling. Is drooling also related to our dental problem?
It definitely related to the oral hygiene. If you are not brushing and flossing, obviously you are holding food in your mouth. So when our saliva tends to be more when we have something in our mouth, right? Even though it's not like big chunk of food, but something is there, saliva needs to flush it. That's what its role is. If you brush and floss, you will see less drooling.
I mean, I see slightly older people, they drool every day, and what could be the reason?
It's mainly the oral hygiene, because that's what I'm saying. Like if something is in your mouth, the saliva has to be formed to flush it out. If you are not flushing it out by yourself by keeping your teeth clean, the saliva will be there. And when you see the drooling, because as we get older, the muscle stretch is muscles are laxed. You younger people, they tend to keep their mouth more closer than the older people. So obviously when the mouth is open, the saliva can go out too. That's how the drool happens.
Absolutely.
Yeah.
Okay. Yeah.
And in India, we don't make a habit to our children of regular flossing. Actually,
Yes.
we just tell them to do just twice, brush your teeth twice a day.
Yes.
But we don't make a habit of. But the flossing is the main reason. I think flossing is the main reason to keep your teeth healthy and everything.
Actually, brush cleans from the front and back only. In between, brush does not work. That's where actually food gets trapped, and that needs to be out.
Yeah, definitely.
Can I ask?
Yes,
Doctor, very nice session. Thank you so much. What do you think about swishing?
It helps. It helps. It's the same thing. When you swish, it pulls out the bacteria from between the gums and teeth. Like gums, they are not they are not attached to the teeth. They are very close to the teeth. There is a space in between. When you swish, I know you're talking I think you're talking about the oil pulling.
Yes.
That actually helps to pull the bacteria out from those, because when you swish with the oil, there is a negative pressure, the pressure created in around the gums, that pulls the bacteria out, and it is helpful.
It is. Thank you. But some doctors don't, dentists don't recommend.
Actually, this is something. Actually, the thing is, this is not taught in the school. This is it's a kind of home remedy.
Yeah, it's Ayurvedic, basically.
Yes, yes. Like again, when we talk to the patients, this is something, if you are doing with the floss, if you can floss, then you don't really have to go for another. This is another aid.
Okay. Once a day flossing is enough.
Once a day flossing,
bedtime,
bedtime. The bedtime is the best, because bedtime is if you are finishing your dinner at, let's say, 7 o'clock, you brush at that point, and then you're taking your breakfast at 8 o'clock. So for 13 hours, your mouth is clean. So that helps with the gums condition, and it helps to keep the gums healthy.
Thank you so much.
You're welcome.
And one more question. Are you connected with the senior dental care?
Actually, that is with the public health. They haven't given this to us yet. I do have some patients who wanted to go there. I know they have a very long wait time.
Yeah.
That is frustrating, but they haven't given this to us. So you have to go there.
Thank you.
You're welcome.
तो डॉक्टर सैनी से और भी कोई क्वेश्चन करना चाहे तो अभी टाइम है, आप पूछ लीजिए। यहाँ पर तो आपको जो भी क्वेश्चन है, कुछ भी बात है, वो फ्री है। क्लिनिक में जाएंगे तो आपको
No, I can give you my cell. You can send me a message. I'll answer you. No problem.
Thank you so much.
आपने बहुत अच्छी बातें कही, और उसमें सबसे बड़ी बात जो आपने कही है, जो जनरली हम कहते हैं, प्रिवेंशन इज बेटर देन क्योर। तो हम जैसे अपना देखिए, जो हमारा माउथ है, आई एम जस्ट गिविंग सम कमेंट्स कि ये हमारा खाने का एक गेट है,
Yes.
जिससे कि इस गेट को क्लीन जितना होगा उतना फ्लो अच्छा बनेगा। देखिए हम
Right.
जब खाना खाने लगते हैं उससे पहले अपने हाथ वगैरह धो के रखते हैं, साफ करते हैं, ताकि जिस अच्छे खाने को हमने खाना है तो उसका जो रास्ता है वो भी एक अच्छा होना चाहिए। हमारे दांत साफ होने चाहिए, हमारी जीभ साफ होनी चाहिए, अल्सर
Right.
वगैरह कुछ ना हो। तो ये सारी चीजें जो हैं ये सब दूर रखने के लिए अपने, जैसे इन्होंने कहा, आप अपने माउथ को बार बार जो है रिंस जरूर करिए, कुरला वगैरह जरूर करें, कुछ भी खाएं तो अपने माउथ को जरूर साफ कर लें, और नहीं तो पानी से कुरला कर लें। एवरी टाइम ब्रश नहीं हो सकता, लेकिन ये छोटी छोटी जो चीजें हैं ये आपको बहुत हेल्प करती है। जैसे उन्होंने कहा कि फ्रूट, खासकर जो फ्रूट है ना, हम कहते हैं कि वो जूस की बजाय फ्रूट खाइए, तो उसका जो फाइबर्स हैं, जो उसके रेशे हैं, वो कभी कभी आपके दांत में जो जगह बीच में है वो उसमें फंस जाते हैं, तो वो ऑटोमेटिकली एक नेचुरल फ्लॉस हो जाता है जब वो आप उसको निकालते हो। सो फाइबर वाले फ्रूट खाइए, वो भी आपको काफी फायदेमंद रहेंगे। डॉक्टर साहब, आपने कहा कि जो है ड्राइनेस ऑफ माउथ है वो लेडीज में थोड़ी ज्यादा परसेंटेज है,
हाँ जी।
तो अगर उनके जिन विदाउट मेडिसिन, मैं मतलब कि कहूँ कि उनके सामने आप चाट या गोलगप्पे रख दीजिए तो क्या उनके मुंह में पानी शुरू हो जाएगा? दैट विल बी आल्सो।
Actually, that's not how things work.
वैसे ये इसमें मैं कुछ कहना चाहती हूँ, ये गुरुदत्त जी गलत कह रहे हैं। ये दिस इज एप्लीकेबल फॉर एवरीवन। विमेन को ज्यादा बोला जाता है उनके बारे में। मैं
मीता जी, वोमन के लिए मैं बोली, उन्होंने कहा कि वोमेन्स में 32% जो है ज्यादा ड्राइनेस होती आती है, तो इसलिए आप देखिए, मैंने कि चाट पकौड़ी की दुकान पे लेडीज कम खड़ी होती हैं, जेंट्स ज्यादा खड़े होते हैं।
यस यस। मेरा इसमें रिलेटेड एक क्वेश्चन है, ये ड्राइनेस स्ट्रेस से भी तो रिलेटेड है ना? जब जैसे हमें काफी कहीं, स्पेशली लाइक जैसे आई एम अ परफॉर्मर, तो बिफोर एवरी परफॉर्मेंस तो मुझे तो काफी ड्राइनेस होती है माउथ की, तो आई हैव टू
Actually, that is short term. That is short term.
Okay.
Right? When we talk about dry mouth, that as a long-term condition.
Okay.
Like ladies, the menopausal ladies, they have a higher chances of getting the dry mouth. Maybe, okay, as you're talking, maybe you have noticed when you were younger, like in your 20s or 30s, you were not having that kind of dry feeling when you were performing as you have now. It has definitely, like, are things, they play the role. So this is when it's long term, we call it dry mouth. When it's like key ongoing. It's not that just particular time. That is stress, that goes away. You done, you part is done. And now you're fine.
Yeah. That is just a temporary anxiety.
Yes. Anxiety does cause the dryness, but it is not long lasting.
Right.
Okay. Hania, you were saying something?
I was gonna say this is a really amazing session. One thing I got to know a lot is because I'm like right now I'm not a senior, but I do have a dry mouth at times, and my lips are often dry. So I think I got my answer to that.
Right.
That to always take water, and that I'm gonna try.
So right now, like even my mouth is dry because I was constantly, and I put my water here and I drink it before. So that is always there when we do it, right? So I have it, but it's too big.
आपने एक और बात बड़ी जबरदस्त कही है उसमें कि जो ब्रश है वो अगर खराब हो तो, और 3 महीने के, और कैसा ब्रश जो है कब ज्यादातर
brush has to be soft. It has to be soft. Like when you buy the brush, it has to be soft. Don't buy the medium, don't buy the harder. And even with the soft, you can hurt yourself. But if you are buying the medium or harder, it's gonna hurt more. And those bristles, they poke through the tissues. They cause the gum. They also cause the bleeding because they damage the gum. And then always do from the top to the bottom. Like go from the top and do and for the lower like this. Never do like this. This also damages everything. The root get exposed, and when this is the scrubbing movement. When you go like this, you actually scrub really hard, and that damages the teeth. And when the roots are exposed, you can actually see the dents in those areas, causing you the sensitivity.
Yeah.
And how much time it should take to brush?
2 minutes is fine. Like if you divide into 4 parts, taking from the middle and upper right and upper left, and then lower right and lower left, you spend half a minute on each side, because you are doing from this side, going this, and doing from this side.
क्योंकि मैंने देखा है बहुत से लोग बहुत देर तक करते रहते हैं ब्रश को, दांतों को घिसते रहते हैं, और कई लोग ऐसे देखे हैं कि मुंह में ब्रश लेके बातें करने लग पड़े हैं या शेव कर रहे हैं, तो क्या वो सही है?
Actually, you are wasting time. That is not called brushing. Okay,
I think you should brush your teeth with full concentration.
Yes.
And
that
rhythm.
That time should be exclusive for the oral care.
Yeah.
And it's 2 minutes.
2 minutes is enough. Yes.
Yes. And 2 minutes, and it's your own time. Do it properly. And like there is another thing. I have this is something new I got. Like I had a demo from the Waterpick and they got it. This Waterpick has a brush. The same brush flosses also. Trust me, I love it.
Oh, really?
Try that if you want to look for something like that.
Oh, nice.
I have a comment to add. I actually had braces in college, but when I did try to use a Waterpick, I didn't find it very helpful. Like, is there a certain technique in there, or how does it go? Because I still don't understand how you use Waterpick even now.
Actually, if you see teeth are like this, your Waterpick tip should be between the teeth. So when you activate the machine, water is automatically going through and through. You cannot stop the water. Like those areas when you have the braces done and you have the wire inside, you cannot floss. So water, you cannot stop the water from going anywhere, from in between the teeth. So when you direct through it, it helps. It has to be right in between 2 teeth. You will feel the water going through it to the other side.
So do you recommend the electric brush also? Some people use here, so it's very common.
Actually, like if you see the benefit wise, they are fine. Electric brushes, like for some people who have like any disability, it's very, very helpful. But otherwise, if you can brush manually good, that's good too. It's not that for general public, it's the same. But somebody especially seniors, if they have the arthritis, they cannot really maneuver too much, then power brush helps because it does everything by itself. You really don't have to do. You just have to hold the brush there. The rest it does itself.
Yeah.
So my question is, do dentists also need dental? Do they also get those cavities and they go for RCTs and implants and all that expensive dental treatment?
Okay, I have one root canal done, but that is from before I went to the dental school.
Okay.
So I got that when I was in grade 11 or 12.
Okay.
And I'm the person, I don't feel pain, right? So I never felt any pain. I never had any issue there until I was only feeling the cavity, nothing. And doctor did something, but it still ended up he put the filling in. One day the filling fell. I said, okay, what is it? And I had no pain. I went to, that time I was in the dental school. I went to the department. I said, she was the assistant professor then. I said, ma'am, this is the problem. I want it to be filled. When she started filling, she said, Prabha, this cannot be filled. You need a root canal. I said, huh? But I never felt any pain. I did have the filling, but I never felt any pain. Because if your pain threshold is high, you won't feel it. And you may end up into those things too. But that is the only one I have.
Okay.
And obviously in future, because root canals, they have the life. They have a life up to 20 years. And this is more than that. So at some point, when root canals start to fail, obviously I will need an implant or something to do there.
But these days they have painless root RCTs, so no problem, I think.
Yeah. But this is already treated, so I'm fine for now.
Cool.
Peter
So
ji,
that was
dentists are also human beings.
Yes, that's true.
my nephew is also a dentist here. So in lighter vein, I'm just telling you. So he said, he always says one thing. Oh, itna painful hota hai dental treatment. He's minting money. He's got a very good practice. He's
Yeah.
an orthodontist.
Okay.
So मुझे समझ नहीं आता लोग कैसे करवा लेते हैं. मुझे तो एक RCT में ही जान निकल गई. ये कैसे लोग ट्रीटमेंट करवा लेते हैं. By God. तो I asked him कि why don't you look after your, he's my nephew actually. So मैं कहती you should look after your teeth. You're a dental doctor. तो तुमको होना ही नहीं चाहिए. तुम इतना ध्यान रखो अपने दांतों का. ओ इतना ध्यान नहीं रखा जाता हमसे. जो हो गया सो हो गया. तो ऐसे भी अप्रोच वाले लोग होते ही हैं.
See, as he said that they are also human beings.
हाँ,
Right?
नहीं, बिल्कुल. So thank you so much, Dr. Prabjot. It was really amazing, and the question hour session was also very, very enlightening and very bright. I mean, we hope that we get better teeth, better facilities. Thank you.
Yeah.
Definitely.
need to
Thank you
use
so
the
much.
better facilities.
Yeah. And for better facilities, we would be coming to you for that.
Sure, anytime.
Yeah, thank you so
सनी आप
much.
बात कर
Thank
रही थी
you.
ये सेंसिटिविटी के लिए, उसमें जो सेंसोडाइन वगैरह हेल्प करती है, और आपने भी कहा कि आप कुछ ट्रीटमेंट वगैरह भी दिए जा सकती हैं टू सर्टन.
Yes.
एंड आई एम ए होम्योपैथिक प्रैक्टिशनर फॉर द लास्ट 50 years. इंडिया में मैं अबोर में प्रिंसिपल भी था, और यहाँ पर मैं प्रैक्टिस कर रहा हूँ, और कॉलेज ऑफ होम्योपैथ का मैं कैशियर हूँ, ट्रेजरर. सो मेरे पास भी ऐसे कई पेशेंट आते हैं कि भाई ये सेंसिटिविटी के लिए खासकर जो है. सो उसमें मैंने 2 मेडिसिन देखी है होम्योपैथी में जो बहुत ही अच्छा काम करती हैं. वही तो है, यही आपने जो कलकेरिया फ्लोरिका है, जो फ्लोराइड एंड मैग्नीशियम फास्फेट.
Okay.
2 मेडिसिन हैं ये 6x में बायोकेमिक में. तो मैं जनरल पेशेंट को बोलता हूँ कि ये आप 400 गोलियां दिन में 4 बार खाइए, और 3 महीने के बाद इसका असर शुरू होगा. एंड आई हैव सीन इन माय 50 years practice, I have seen at least more than 90% people got great benefit. जो कि सेंसोडाइन यूज करते थे वो बंद हो गया उनका सेंसोडाइन लगाना.
I don't recommend that to be used all the time. The recommendation there is, I always tell my patient, don't start using it as a toothpaste. That uses its effect.
These are the small biochemic tablets.
That I know. Like even with the Sensodyne, like I never recommend patients to start using it as a toothpaste. This is use it as a medicine. The thing is, use any normal toothpaste, and if you feel sensitivity, let's say on any tooth, take a little bit of Sensodyne, apply it as an ointment, and leave it. And you see, if you after that a minute or two, you rinse your mouth, you will feel the difference. Instead of brushing with it, when you use it as an ointment, you will actually feel the difference that Sensodyne actually works. I see so many patients, they say, oh, I have been brushing with Sensodyne for 6 months. It's not working. With 6 months, you get used to it. Your body is not reacting to it anyway. So use it in moderation and use it in proper, like as an ointment to make it work. That's where, like, I think we have the things available. We have to use them in a way so that they work for us.
Yes,
that's a better idea. Very nice.
So अभी टाइम है अपने पास ये खत्म हो गया?
Time is over, but no problem. We are here. If something is left.
But अनुजी को मालूम है कि कितना हमें ये जो Zoom का टाइम लिया होता है ना?
Okay, it's already 5:30.
Yeah, I think we should conclude. It was an amazing session, Dr. Saini.
Yeah,
thank you so much. आपने इतने busy schedule में से time निकाला. It's so much appreciated.
Yeah,
thank you so
we
much.
all are thankful to you. And
thank you. And Dr. Prabjot has her clinic at Etobicoke. Do you want to share your address and phone number, Dr. Prabjot?
Where is the message? I don't see it. Okay,
The chat function at the bottom.
Chat.
Chat, okay.
और मीता जी, do you mind आप ये उसमें भी शेयर कर लेना WhatsApp
हाँ
में?
जी, हाँ
या
जी,
व्हाट्सएप पे शेयर कर देंगे या
जी।
LB Dental Care. I think I know that place. Is it around the corner where they have the Alakwan store?
Yes.
Because I used to go there. There used to be a doctor called, I think, Amandeep Gupta or something. I think that was her name.
No.
I think.
No, that is, oh, okay. You were talking about Amanpreet Chopra. She's
Yeah,
far from
her.
here.
I forgot her exact name. Like, is it that plaza?
No. This is not there. It's we are close to Martin Grove and Albion.
Oh, okay. Then I was seeing the other side. I was seeing the side where they have DQ. They have like a High Point there.
Yeah, that is on Islington and Albion. I think they are there.
Okay, I see. But when you mentioned Albion, I'm like, oh, my first dentist used to be there. That's why.
Actually, there are so many here. We are so many here.
Okay.
Okay.
That's very nice. Four, 1, 6, 7, 4, 5.
I'll send you on the WhatsApp.
That's good.
I'll send you.
Yeah, thank you so much.
Problem.
Though I think my family would be having everything, but still, if you send it, that'll be proper thing. Thank you so much.
All right, it's 5:32.
Yeah.
Should we end our session with Gurudat ji's song?
इंसान का इंसान से हो भाईचारा, यही पैगाम हमारा, यही पैगाम हमारा। इंसान का इंसान से हो भाईचारा, यही पैगाम हमारा, यही पैगाम हमारा।
Absolutely.
Thank you.
Thank you so much. Thank you, everyone.
Bye bye.
Okay.
Bye.
Okay, bye.